I decided to be a DO, a doctor of osteopathy, because my family doctor was a DO. I grew up in West Virginia, and most of our physicians that were local and were primary care were DOs. I went back home to West Virginia School of Osteopathic Medicine. I applied to one medical school, and that's where I went because I wanted to be a family doctor like my doctor was. The biggest difference in a DO and an MD on a daily basis is maybe just the philosophy in which they were trained, although even now those differences are less, as all of medicine is trying to have more of a holistic approach to patients. There are still many DOs that do hands-on modalities, but generally that's more specific to primary care. But most of the time when you go into an office, you won't notice maybe the difference between a DO or an MD as a patient. Having a family physician instead of going to different walk-in clinics or minute clinics for all of your healthcare needs is important, because your family physician can see what your history is, see what is going on, and start to maybe see some trends. You can receive care at any of those other places, but being able to have one office and staff that knows you and knows your health history to help guide you and treat you in the big picture and not just the acute event that you're there for. Coming to see your primary care physician on a routine basis for a healthy adult may just be once a year. For someone that has any kind of chronic illnesses such as diabetes or hypertension, you may need much closer follow-up, maybe every 3 months. And that is something that can be outlined with you and your physician. In terms of preventative health, once a year, then you can make sure to get your flu vaccine and any other preventative measures that are necessary. Also go over anything that may have changed in your history or your family history over that year. Mountain View Medical is a great primary care office. You will receive evidence-based medicine and quality care, respect. You will be treated for your needs. It's also a smaller setting. You're not just a face or just a number. Relationships are built there, and you'll know who you're seeing and who's taking care of you.